Thank you for joining us for the Hepatitis Foundation International's Lunch and Learn video series about various populations and their relation to viral hepatitis. My name is Alyssa Miller, and I'm an associate here at HFI. We are launching this video series to bring awareness to not only hepatitis, but also the new report by the National Academy of Sciences that says we will be able to eradicate viral hepatitis by the year 2030. HFI believes that a large part of the eradication process needs to be focused on hard-to-reach, hard-to-treat individuals, which includes racial and ethnic groups, injection drug users, substance misusers, incarcerated inmates, Medicaid recipients, veterans, homeless individuals, and other groups not typically associated with the viral hepatitis, such as renal patients and hemophiliacs. And what better time to talk about hepatitis eradication than May, which is Hepatitis Awareness Month. So today I would like to welcome Dr. Claire Nelson, who will be discussing viral hepatitis as it relates to Caribbean immigrants. Would you mind telling us a little bit about yourself, your area of expertise, and how you became interested in the Caribbean population?
Well, I have to begin by saying, first of all, I certainly would not consider myself a hepatitis expert. I'm Dr. Claire Nelson. I'm president and founder of the Institute of Caribbean Studies and chief ideation leader of the Futures Forum. And one of the things we're concerned about really is health equity, health access, and of course, trying to ensure that we do reach health for all by the year 2030. We're very committed to the UN Sustainable Development Goals and ensuring health for all. In that regard, then my interest in this whole issue of hepatitis, now that I know what it is, I was not aware before, let's say last 2 years ago, since our involvement with HFI, and hepatitis and was a viral disease. I was not aware that it affected the liver, and I was not aware that so many people actually suffered from a needless disease. So when something is needless, and you say that to somebody who considers himself a change maker, my intention is to begin to serve the process of education about the need to be tested and to help where we can as the Institute of Caribbean Studies in making sure that people who are in the healthcare system in the Caribbean community in the US as well as in the Caribbean region are aware that there are ways to prevent hepatitis C and in fact eradicate it by 2030.
Now we'll just transition into the questions, if that's all right with you.
Yeah, sure.
Great. So our first question is, why is this population being overlooked, and how can we help bring awareness of this population to the foreground of hepatitis awareness?
Well, I'm not sure if there is a, let's say, direct attempt to overlook the population. It's simply the way the healthcare systems are structured. There's often not the awareness. There are cultural ways in which people acquire information. There are cultural ways in which personal information about healthcare is shared. And there are norms in different communities about what is secret and what is held private. And so, because there doesn't seem to be a very clear way, for example, HIV/AIDS had a very clear, strong and visible message. I don't know if many people in the Caribbean community understand what Hep C is. I mean, I consider myself an educated person, but before I knew about Hepatitis Foundation, I didn't really pay attention to it. It had no meaning to me. I didn't see it as something relevant to anybody that I would know. Mm-hmm. It was just some random disease related to some random thing that had no bearing on people that I would know. So I think the messaging and the way one needs to look at cultural differences and dissonances in approaching information and education awareness is a very important thing that has to be done in the hepatitis treatment community in order to get to the right targets and to treat them differently from day one.
Mm-hmm. And we're definitely hoping that this will help reach people who are unaware of hepatitis, because it is something that doesn't reach, the foreground very often.
I think there needs to be a much more, let's say, clear discussion. What does it look like? What does it feel like? First of all, if it has no feeling until you're already almost sick and dying, you don't know to get tested. So, for example, let's take my case. If you don't wear glasses, it's highly unlikely you'll go to the eye doctor on a regular basis. So if you are at risk for glaucoma, you're not going to know until it's too late.
Yes.
Now, because I wear glasses, so do you, we go to the doctor all the time. Mm-hmm. And so at one point, a doctor said, why don't I just test your eyes? And I'm like, wow, your pressure is high. And if we hadn't caught it, you might have been in trouble in 10 years.
Yes.
or 5 years, because nobody knows the rate of progress of the disease and what causes it exactly. So since hepatitis C may not have any symptoms until too far in the game, there needs to be a more general awareness made to people say, okay, at a certain age, you might want to do it as a random test, the way you do a random test of anything else. You know, you do at a certain age, you start doing breast cancer screening. At a certain age, you start doing pap smears. So at a certain age, you should just be taking a Hep C test. No, again, that's assuming you have healthcare. There's a whole other of questions, because if we have a situation where communities don't have access to healthcare, how are we going to provide the testing? Are there ways in which we can create partnerships going forward that will allow the testing material and equipment to be affordable, so that underserved populations in the insurance space can get access to preventative care? And that's, I know it's not relevant necessarily to the question you asked, but I do want to drag us into that direction, because that is a critical area. Certainly in the US, Caribbean American community, for the people who are in the self-employed community, I'm sure many of them don't have access to preventative health care. So how are we going to reach that group? In the Caribbean region itself, where again, if you're in the informal economy, you're not working for a federal government or a national government agency or a large company, you're not going to have preventative health care insurance. How are you going to create affordable testing systems? Can we really move rapidly to the new technology and create affordable testing system, you know, the swabs in a cheek or something? So I think those are things that have to be on the table very soon if we're going to really make a dent in moving the needle towards ending hepatitis C by 2030.
So you really answered my next question, so I'll just go ahead and skip to the third one. What are some cultural awarenesses that need to be kept in mind when working to eliminate hepatitis within this population?
I think many Caribbean people are very private about the way we deal with health. I mean, especially if it's something that it's sexually transmitted, forget it. You know, although we might seem to be a community that is full of wild abandon and reckless behavior with drinking, etc., and carnivals that people have naked on the street, in some ways we're very conservative and private, and it's a sort of a dichotomy or a conundrum that is weird, but it really is a fact. This is why, for example, HIV/AIDS had such a really difficult challenge in getting people to address it in the region. Homosexuality is something that, you know, it's visible, it's really preferred not to talk about. I mean, of course, it's changed in the last 20 years, but back then, which is where we are probably with Hep C, we're kind of beginning the new climb, if you will, to reach a certain target in number of, let's say, contacts with the information. How many times can we get information contacted? So in societies in the Caribbean community where we're trying to tell our children, for example, not to have sex, I mean, and churches are preaching abstinence, how are you going to talk about a sexually transmitted disease? We don't have a lot of, let's say, high incidence of needle drugs in the region, Caribbean region, or drug of choice, I presume, will be probably marijuana, so the probability of getting it from that is going to be very low. Cocaine addiction in the region is also very low. So drugs are not going to be the way. So it will probably be a sexually transmitted disease. So how are you going to include this conversation in your classes on sex education, which already exist? Certainly in the region, it's easier because you have a population that's right there. In terms of the US Caribbean community, which are a minority community, it depends again on where they find their health care. If it is that they're in a system where you're in a federal government agency or state government agency and you're going to the traditional, let's say, you know, managed care systems, again, depending on how comfortable they are with the doctor, and if doctors are not trained to kind of break down that barrier that many Caribbean people feel about talking to their doctor about certain things, it's not going to be covered. So maybe we have to say, okay, let's focus on the gynecologists in terms of women, and let's get the gynecologists that are, first of all, working with a lot of those populations of different cultures, African immigrants, Caribbean immigrants, who also see doctors as authority figures in many cases and don't question what doctors say. Can you have the literature out there and available in doctors' office, in waiting rooms? Again, another partner, but we might want to think about where everybody would be, not just the Caribbean people, would obviously be the drugstores. Can we have information as you're waiting to pick up your other medications for your blood pressure or diabetes? Can we have information available at the drugstores that would make it easy for us to get that information? Targeted information should be done through the doctors that serve the community and through really working with organizations such as ICS. I mean, we do have a network of Caribbean organizations around the country that we partner with to do cultural things. We have a lot of carnivals. Can we have information at the various carnivals and festivals around the country? And carnival season tends to start, I think the earliest one is in April in either Texas or Arizona, and it goes all the way down to Nevada in November. So you have a season of events and people are out there in droves. I do believe that one would want to have certainly an approach that looks at the ways in which Caribbean people get information or absorb information and knowledge and change that information into knowledge. In the Caribbean region, clearly you can have a sort of a outreach to the general population. You know, you're working with pharmacies, working with the school system, the universities to get people to get tested. And it's more direct and you can find different ways fairly easily. But in the US, where we're sort of hidden within different subpopulations, we have to be a little bit more creative. We have to identify perhaps doctors that reach those populations. I would say probably in the case of women, gynecologists would be the ones they would feel most comfortable to speak about sex to, because they have to talk about those things anyway. In the case of men, maybe they're urologists, but since men hardly even want to go to the urologist, you have to go to the general practitioner for men because they try to avoid the doctor at all costs.
Yeah.
So there's that. So the doctor's office is certainly reaching out to doctors that serve those populations, especially in the high density areas of New York or the Atlanta or the Florida, Houston, where we have high densities, and have it trickled through, like through families knowing about it. The second way an approach might be to say, consider how do you get information out to the general community? And again, working with a group like ICS, Institute of Caribbean Studies, we have a national network of organizations that we have our relationship with. And so we could probably use the carnivals and the festivals to pass information along, but make sure we do the information in a way that's palatable. So you might want to use, a graphic novel, for example, or something. That's a dry pamphlet because nobody's going to really read a dry pamphlet. I mean, if it's a card, one card, yes, but get tested because did you know? But if it's something that's really going to grab their interest, using stories to kind of get that information to it moves them, wow, a piece of data to know something that calls them to action. And I think these are some simple ways in which we can begin to take a stab of this particular subsection. And this particular approach could also probably work for people in the African immigrant community, to be quite frank, who also have some of the same issues.
What barriers do Caribbean immigrants experience regarding access to treatment for viral hepatitis?
I have absolutely no idea.
Okay.
Comes to that issue because, as I said, I'm not really in the treatment place. I'm more in the social marketing, social awareness phase. How do we create that? How do we create a network of information? How do we create a network of providers? I mean, I would assume the barriers to entry and treatment would be for primarily those people, for example, who are not insured. And again, I come back to the issue. If you don't have insurance, you're not even going to get tested. So how could we be treated? And so the issue goes much deeper than, let's say, perhaps the purview of HFI, but certainly HFI as an activist and advocacy organization within the healthcare spectrum certainly would want to, I presume, push to ensure that, the whole, whether it's Medicare or Medicaid or, other affordable healthcare, ACA or whatever, Obamacare, whatever will come after Obamacare, has to have preventative care, and testing needs to be a part of what is provided at an affordable level. So if you say to get a test you only need to pay $15, let's try and find a way to make it affordable so most people can afford that $15 or $20 to do that test.
What needs to be done to overcome these barriers?
Well, I started talking about overcoming barriers of affordability. Right. I think affordability is the biggest issue in terms of, okay, so once we know, then what? If it's too expensive, then it's not going to make a difference. So I think affordability has to be the question. We have to see what is happening in terms of new technologies that's making testing more affordable. We have to convince the drug companies, we have to convince the National Institute of Health, and all the agencies that are involved in the, let's say, the supply chain of the spectrum of how do you provide not only testing drugs, but also treatment drugs at affordable level. And so it talks about from a systemic perspective, which is my interest as a systems, I call myself like a systems change agent or systems change maker. As from a systems perspective, it is about putting together the entire chain from source to, cure, if you will, all the people and stakeholders along that value chain or supply chain to ensure that we have a system that is a mesh of information and funding and pricing that everybody can be involved. Because even some doctors might say, I don't want to do this because I'm not going to get enough reimbursement that's worth my time. So you really have to look at it from the perspective of all the different stakeholders in the system that are relevant.
Right. So that was my last question that I have. Thank you so much for taking time to speak with me today and helping to educate our viewers on a topic that previously may not have even been on their radar.
Well, thank you for the opportunity. And again, as a partner and a member of the Scientific and Medical Advisory Board of HFI, I'm really eager to see us, get started, be able to have the resources necessary. I know we're in a very challenging climate right now, but certainly using Hepatitis Awareness Month to begin to amplify and shed a light on this somewhat, I would say, obscure part of the healthcare system is very critical. And I'm really, privileged to be a part of this process. So thank you for inviting me.